is the Thriving Dentist Show with Gary Takis, where we help you develop your ideal dental practice, one that provides personal, professional, and financial satisfaction.
Welcome to another episode of the Thriving Dentist Show. I'm Gary Takis, your podcast co-host. We have a great episode for you today. It's titled The 7 Pillars of a Thriving Practice. Lots of details today. I'll get into those in just a minute. But before we do, a couple of announcements to make. Coming up about a month after this episode is published, we have our next masterclass. It's on September 26th, 7 to 10 p.m. Eastern Time. This is a brand new masterclass. This is the first time we're offering it. It's titled Keys to Creating a Practice That Provides Work-Life Balance. And in that, as might be evident by the title, in that episode, I'm going to talk about all the things that you can do to move towards a better work-life balance and to ultimately achieve an effective work-life balance. And I'm going to suggest that if you experience success in every other aspect of your practice, but it comes at the expense of your relationships, time with your family, maybe time to pursue health and wellness activities, your hobbies and interests, then I'm going to say that that isn't success at all. I personally believe there's an epidemic in dentistry of poor work-life balance, and I'm on a mission to help change that. So in that masterclass, I'll share lots of useful information that you can apply immediately to ultimately achieve an effective work-life balance. That masterclass is 3 hours long, 7 to 10 p.m. We run it more like a workshop than a lecture. So lots of useful information that you can apply. Very affordable, less than $90 of tuition. If you'd like to register, go to thrivingdentist.com/masterclass. All of our masterclasses sell out, even though they're virtual. We do limit attendance because I do run them more like a workshop than a lecture. So if you'd like to attend, be sure to go to thrivingdentist.com/masterclass, and I hope to see you there. The next announcement I have is we have a new guest contributor. Her name is Dr. Alice Wang. She's originally from Australia, and she is going to share with you top 3 tips to create a raving fan base for your practice. We're going to invite Dr. Wang to come back and contribute in the future because she's bright, she's articulate, she's got some great concepts, and you're going to love what she's about to share with you about the top 3 tips to create a raving fan base for your practice.
Hi, Thriving Dentists. Today, I'm going to share with you my top 3 tips in creating a raving fan base for your practice. And that's making sure your patients are comfortable. Patients can't really tell the quality of your work, but what they're judging you on is the experience they had in your office. So if you're able to do a procedure, and not just for those procedures that's really difficult, like dealing with a hot pulp, but any procedure that's really simple for you, but really difficult for the patient, like a single crown or a couple of fillings or perio treatment, if you're able to get this patient through the procedure without causing any pain, you're going to win them over, their entire friends and families. My tip number 1 is central desensitization. When there is a chronic infection, the brain is sensitized to feel pain sooner and at higher intensity. So when the patient comes in with infection and inflammation, pre-medicate them with 600 milligrams of ibuprofen an hour before and painlessly do the procedure and prescribe them a post-op medication, 400 milligrams of ibuprofen every 8 hours like clockwork for the first 48 hours. And on the 3rd day to take it as needed. You can also alternate that with ibuprofen and paracetamol. They are synergistic, so every 4 hours, take it like clockwork for the first 48 hours, and on the 3rd day, take it as needed. Even for cases where you haven't started with any pain, there's going to be some sort of sensitization and some sort of inflammatory markers going on. So let the patient know and set that expectation that they're going to feel pain. They'll feel uncomfortable, sensitive. The tooth is going to feel like it's been worked on for the next 3 days. Tip number 2 is to give 2 blocks and accessory injections. The first inferior alveolar block is unpredictable. The success rate for the nerve block is anywhere between 18% to 80%. So that's a huge range that you want to gamble with. So do the first injection very slowly. Take at least 3 to 4 minutes to do the first injection. So you've got less tissue distension and less pain from the injection itself. And you can give your second block much faster and you get profound anesthesia. Don't be afraid to do your intrapulpal, intraligament, intraosseous injections, buccal lingual infiltrations to make sure that your patient is profoundly numb. Number 3 is to take note of the anesthetic time. Dentistry is a surgical specialty. You don't want to let your patient tell you, I'm feeling pain. You don't want them to flinch, get your anxiety up, get their heart racing. If it's been 90 minutes since your first injection, give them a second dose and make sure that you're not interrupted, your patient's comfortable, and most importantly, that you are comfortable. So here are my top 3 tips. Number 1 is central desensitization. Give your patients the pain management strategies before and after your treatment. Number 2, give 2 inferior alveolar blocks and any accessory nerve injections where appropriate. Don't be afraid to do intrapulpal injections and intraosseous injections. Number 3 is to take note of the anesthetic time, and as your anesthetic's going to wear off, top them up before the patient lets you know that they're feeling something.
Welcome back to the Thriving Dentist Coaching in Action segment. This is Naren, your co-host. I want to take a minute to thank Dr. Wang, Alice Wang. Wonderful tip. We are going to make sure that that video is included along with the show notes, so you can go there and watch the entire video that Dr. Wang created for the Thriving Dentist community. And I agree, we all need to work on, creating more fans, right? People who love us, people who tell their friends and shout about who we are and what we do off of the rooftops. So thank you, Dr. Wang, for that. Gary, I'm extremely excited about our episode today. I think this is one of those game changers. Once in a while, you come up with these unbelievable concepts that, make or break a practice. And of course, not break it, but make it. And in this particular case, the 7 pillars of a thriving practice, right? So I know you have been talking about this for a while now, and you have been going back and forth. And finally, you arrived on the key things, the 7 key things that are really, really important for any thriving practice. One of the famous quotes that I heard that had an influence on my life is by the gentleman named Chet Holmes, late Chet Holmes. And he talked about, like, great people don't do hundreds of things or thousands of things. They do 10 things 10,000 times. In other words, they find those pillars and then they keep working on those pillars day in and day out, every single day, every single week, and they master it and they don't stop. They make it even better. So, Gary, I'm really looking forward to this awesome conversation about the 7 pillars of a thriving practice.
I'm excited about this one, Naren. This episode is a combination of putting a couple things in the blender. One of the things I put in the blender is my own philosophy about what truly makes a world-class practice. In other words, what are those things that are evident if you're going to have a world-class practice? But then the second thing that I did was I reflected on what I've seen in world-class practices. What were the common denominators of world-class practices? And the combination of some of the beliefs that I have combined with what I've observed in world-class practices is the result of what will be this episode, 7 pillars of a thriving practice. And as you might imagine, pillars, we're using kind of a symbolism in the choice of that word. Pillars, represent foundational concepts, that the practice, it's not like a passing fad or a passing fancy. It's something that really is embedded in the philosophy of a practice. And then, what does it mean to be a thriving practice? Well, my definition is it's a practice that provides personal, professional, and financial satisfaction. So personal satisfaction means you're taking care of patients you enjoy, surrounded by a team you love. Professional satisfaction means you're doing more of the kind of dentistry you like to do, whatever that is, whatever flavors of dentistry you like, you're doing more of that. And then financial satisfaction, Naren, is a little more self-explanatory. That means you're being rewarded fairly and handsomely for your care, skill, and judgment. So here's those 7 pillars. I'm going to name one. I'll name it, then go into a little bit of detail. And at the end, I'll do a recap on the 7 pillars. And they're numbered. I'm going to number them, not because they're numbered in importance. I think they carry equal importance and equal weight. But I will number them so I make sure I cover all 7. So no further ado, here's the 7 pillars of a thriving practice. Pillar number 1, a thriving practice is very much a hygiene-driven practice, That's a concept I learned very early on in my career, Naren, and I believe it even more strongly now. Hygiene can serve so many great purposes in a practice, not the least of which it helps our patients become healthier. But we know that if we can keep patients engaged in hygiene, that any treatment that we're suggesting, especially if it's asymptomatic or it's not necessary, it's elective, then if they're involved in hygiene, we can nurture that along so that at some point by them, maintaining our relationship through hygiene, they might be ready to have that treatment done. And some of the ways that you can measure a hygiene-driven practice. So I want to get very detailed with you today. The hygiene-driven practice will have 1/3 of the total office production coming from hygiene, 1/3 of the total office production. And by the way, what we count as hygiene production is everything that happens to the hygiene patient with the exception of the doctor exam. The doctor exam gets credited to the doctor, of course. So ideally, we're looking for 1/3 or more of total office production coming from hygiene. Another way to benchmark a hygiene-driven practice is hygiene occupancy. Hygiene occupancy means what % of your available hygiene appointments are filled. And what we're looking for there is we're looking for 92% or above, meaning that of all available hygiene appointments during a given month, 92% of them or more get filled with a butt in the seat. Now, that's not an easy goal, but it's one that is possible, but it requires a lot of effort and some good systems to have that happen. So pillar number 1, 7 pillars of a thriving practice. The practice is a hygiene-driven practice. Oh, one more comment about that. And that's that within your hygiene department, we're also serious about diagnosing and treating perio disease with conservative periodontal therapy. And a way to measure that is we're looking for 30% or more of the adults in your practice that come through hygiene being treated with some mix of 4 very specific periodontal therapy codes: 4341, 4342, 4355, and 4910. By the way, that percentage was benchmarked by none other than Dr. Rella Christensen, Gordon's spouse, but also a renowned hygienist, founder of 3 hygiene schools, and a PhD in microbiology. So there's 3 metrics that you can use to determine if you have a hygiene-driven practice. Pillar number 2, I'm going to go through this fairly quickly. You have a remarkable new patient experience, Notice that I call it experience. I didn't just call it an appointment, didn't just call it an exam. It's a remarkable new patient experience. I would suggest that you consider modeling your new patient experience off of what we teach our clients. And that's that we've got a combination appointment that includes comprehensive doctor exam, comprehensive records, whatever the patient needs in terms of records, and then followed by a hygiene service of some sort, either a cleaning if they qualify for a cleaning or a debridement if they don't qualify for a cleaning. And the 7 components of the new patient experience that we teach our clients are: number 1, the first 30 minutes are handled by a new patient coordinator. They haven't met the doctor yet, so it's handled by a new patient coordinator. And that new patient coordinator does 4 things during that first 30 minutes. Takes the patient on a quick tour of the office. Purpose of the tour is to make a great first impression and help them understand what's available in our office without any selling. Step 2, we do an interview. We do a 7-question interview in the consult room to learn the patient's dental history, dental story. Step 3, we take a set of 6 digital photos. We use Dr. Frank Spear's format for taking 6 digital photos for patient education. We take those photos. And then step 4 in that first 30 minutes is we take necessary records. Could be bite wings, could be full mouth series, could be a digital panoramic x-ray, could be a CBCT. We may also take a digital scan during that time. The next 30 minutes is the doctor part of the new patient experience, where the doctor does his or her findings and the way they conduct their part of the new patient exam. By the way, our new patient coordinator stays in the room as the examining assistant at that point. Now, she's not an assistant like passing instruments, but she's an assistant at the 12 o'clock position entering data entry. Now, we have that person stay there because that was the person on our team that connected with the patient in the first 30 minutes. So far we've done tour, interview, photos, x-rays, doctor part of the exam. Then we escort the patient down to hygiene. Step 6 is the hygiene appointment. The hygienist is going to start with an IPE, initial perio exam. And then we're going to provide a cleaning or debridement based on what the findings were of the perio exam. And then we're going to finish step 7 with financial arrangements and scheduling. It's a 2-hour appointment in the office representing 30 minutes of doctor time. Now, that can be customized, but that's a format that has worked extremely well. Now, you may not be able to just implement that immediately, but you may be able to move toward that approach kind of step by step. So second pillar, a thriving practice will have a remarkable new patient experience. Pillar number 3, a thriving practice is a relationship-centric practice. Doctor or doctors, if you have multiple doctors, and team members all believe in a relationship-driven practice. That means that we know our patients' names, we know the spouse's names, we know their kids' names, we know the dog's name, we know their hobbies, we know their interests, we know what college they went to. Maybe we know that a particular patient, let's call her Linda, is taking care of an elderly mother right now. Maybe we know that another patient, George, is going to celebrate his 25th anniversary next month. Those are the things that we know. That's what makes dentistry such a rich experience. Dentistry is a people game. A thriving practice is a patient-centric practice where everyone, doctor and team members, every ounce of their DNA, they believe it's important to develop rapport and relationship with the patients we're taking care of. And they, in turn, develop rapport and relationship with us. Rapport is the kind of the first step towards relationship. And then ultimately, rapport blossoms into a relationship.
I think this is really important, Gary, this particular pillar, because I know you have worked with tons of practices. There are those commodity practices, and the number one thing they lack is relationship, because it's all about how fast you can process the patient and go on to the next patient, right? It's all about speed. Relationship is, healthcare is very personal, and being able to have that relationship where you feel like you can trust someone who really knows you, knows your history, not just the last 30 minutes, but for years, and who takes, for who your health is important. So the doctor cares about your health. So knowing that somebody else cares about my health as much as I do, I think that's priceless. And that's why a lot of patients never leave a relationship-centric practice. Even when they move, they come back.
It's missing in so many practice models where, if the practice model is high volume, lots of turnover, it's not relationship driven. It's a commodity-based practice, and a commodity-based practice will never be a thriving practice.
Yes.
Very, very important. Pillar number 4, a thriving practice has a growth mindset. And the growth mindset is built all around the concept of helping more patients enjoy optimal oral health. So it's all built around that concept. Now, growth is a great business concept, as well, but we don't grow to create the business results. The business results are a byproduct of creating growth in our practice. And I would like to suggest that a very good goal for any of our listeners would be to grow by at least 10% a year. And I'm talking about collections, I mean, at least 10% year upon year growth. And that 10% would assume you're not adding any providers. In other words, that would be same doctor, same team. We're not adding more hygiene days. We're not adding an associate doc. We're not adding, more doctor days. But I'd go for at least 10% a year. And then on years where you are adding more providers, maybe more hygiene days, or maybe you're adding an associate doc, then we want much more, of course, than that 10% growth. But that's part of a thriving practice, having a growing practice, and frame it around helping more people in your community enjoy optimal oral health. Pillar number 5, a thriving practice has a proven marketing system to consistently attract quality new patients. It's literally like clockwork. And every month we not only achieve the number of new patients that we need, but the quality of the new patients as well. Meaning that the type of patients that become lifelong patients, the type of patients that are interested in high value services, the type of patient that wants to keep their own natural teeth all their life, and they want you to be their partner in helping them achieve that. And mastering marketing is a very, very important pillar. New patient flow is the lifeblood of any practice. And you can often measure the long-term success of a practice by their success at consistently attracting quality new patients. Of course, we want to retain all our existing patients, and we want them to be patients for life. But if we're going to grow, we also have to attract new patients. Naren, I know you've done a courtesy to all of our listeners that if any of them would like to schedule a marketing strategy meeting with Lila Stone, your marketing director at Equa, any of our listeners can do that at no cost. I highly recommend Equa. We've been using them for almost 7 years at LifeSmiles, and they meet that need. They provide us the number of new patients we need every month and the quality of new patients. To schedule that meeting, just go to equa.com/MSM. And Naren, I know you're providing that as a courtesy to any of our listeners at no cost. Highly recommend. Pillar number 6. A thriving practice is a reduced insurance dependent practice, not necessarily fee for service, but has reduced insurance dependence. Now, you don't have to go all the way to fee for service to significantly improve your practice by reducing your insurance dependence. Very difficult to have a thriving practice if you're beholden to the PPO plans. In fact, I'm an optimist. I like to think that everything is possible, Naren. But is it possible? Remember the third part about a thriving practice? You have financial satisfaction. Is it possible to receive financial satisfaction if you're giving away 45 to 50% to the fat cats at the insurance company?
No, you can't, right? I mean, it's like actual numbers. $1 million practice, let's say that's PPO dependent, is giving up $500,000 to the fat cats at the insurance company.
Yeah, if a practice collects $1 million and they're a PPO practice, typically that practice has to produce somewhere between $1.5 million and $1.55 million in order to collect $1 million. They're giving away over $500,000 a year to the fat cats at the insurance company. And by the way, it's even worse because not only are you limited to what you can collect, that $1 million, but your overhead is not based on the $1 million that collect, it's based on the $1.5 million plus that you had to produce. So no, you're not going to have a thriving practice or a PPO practice. Now, you don't have to go all the way to fee for service, although I always tell my clients that if your goal is, I'm going to be your biggest cheerleader, because that's the way to get the most advantage onto that. But every time you successfully drop a plan, then your practice improves. So a thriving practice is one that has reduced insurance dependence. By the way, if any of you would like to know more about that, Naren and I published a second podcast called the Less Insurance Dependence Podcast. Just go on iTunes, Apple Play, Spotify, whatever your directory of choice is, type in Less Insurance Dependence and you'll find it. We now have over 250 episodes. It's a short format podcast. Each episode is 15 to 18 minutes long, loaded with lots of useful information. You can successfully reduce your insurance dependence. So if you're not familiar with that, jump over there and subscribe to it. And every Thursday, when we publish that podcast, you'll receive useful information you can use to successfully reduce insurance dependence in your practice. In my coaching work, we've helped dentists in all 50 states, over 400 practices in all 50 states, successfully either go free for service if that's their desire, or successfully reduce their insurance dependence. And finally, number 7, the 7th pillar. A thriving practice is one that has a treatment mix that includes some high value services. Whatever those are, you have to choose those yourself, because ideally the high value services should be things you're interested in providing, because that's what's going to make it successful and fun for you. If you're interested in it, you're going to love taking all the CE it takes to become an expert in that area. If you're interested in it, you're likely to be good at it. And it's going to provide you a lot more fulfillment because you're doing the kind of dentistry that really brings you pleasure. So make sure that your treatment mix, if you're a general practice, of course, should have a foundation of everyday general dentistry, but also be sure to include high value services, because that's in part what will lead you to that thriving practice that provides personal, professional, and financial satisfaction. Well, here's those 7 pillars. Let me recount them. Number 1, it's a hygiene-driven practice. Number 2, you have a remarkable new patient experience. Number 3, it's a relationship-centric practice. Number 4, it's a practice that truly embraces not only you, doctor, but your team, a growth mindset. And that's framed around helping more of your patients have great oral health. Number 5, you've got a proven marketing system to consistently attract quality new patients, not only the number of new patients you need, but the quality of those new patients as well. Number 6, your practice is a reduced insurance dependence, because we know that, think about it, Naren, if you're a dentist that's a PPO provider, you're in partnership, if you will. I'm using the term loosely, not legally. You're in partnership with the PPO plan. Why in the world would you want to be in partnership with anybody that does not have your financial interest at heart? All they want to do is commoditize dentistry, drive it down to the lowest common denominator, and squeeze you for every nickel they can get. And by the way, it is a very top-heavy organization, the PPO plan, because do you think all the hundreds and thousands of people that work for the PPO plan are receiving the reward from that? Or is it just the executive committee?
Right.
It's the executive committee. So a thriving practice is one that has reduced insurance dependence. And finally, number 7, a thriving practice is one that provides a treatment mix for you, doctor, that includes some high value services, doing some of the services that really help our patients. And, another way to think of high value services, kind of dentistry that can be truly considered life-changing dentistry. Well, there's the 7 pillars. We're going to go into more detail in the Q&A segment, but I hope you've enjoyed this Thriving Dentist Coaching in Action segment.
Hello, everyone. Welcome back to the Thriving Dentist Q&A segment. I really enjoyed the Coaching in Action segment today, Gary, and specifically what you covered, the 7 pillars of a thriving practice. Hygiene-driven practice, remarkable new patient experience, relationship-centric practice, growth mindset, proven marketing system, reduced insurance dependence, and last but not least, treatment mix that includes high-value services. Thank you for that, Gary. So let me jump into the questions. I have 4 questions for you. I have them lined up. So let me start with question number 1. Like you, I have always embraced a hygiene-driven philosophy. I'm beginning to wonder if that makes sense moving forward, given the hygiene wages we are required to pay in today's markets. Your thoughts?
Wow, what a great question. And boy, I want to just give recognition to the doctor for asking that question, because I've got to think that many of our listeners are thinking the same thing. And you know what? It is harder than ever now. And hygiene wages have really escalated. They've escalated far in the last 3 years. Hygiene wages have escalated far beyond normal, wage increases. And we've got supply and demand for hygienists. It's like any free market system, you've got supply and demand. We have way more demand for hygienists in dentistry than we have supply. And what happens when the supply and demand is out of whack? Means we have to pay more for it. So I understand your question, but nothing about those wage increases have changed my thinking one little bit about the importance of a hygiene-driven practice. Yeah, I mean, yes, we have to pay what we need to pay to attract good hygienists in your community. I get it. But it's not changed my emphasis on that at all. Now, I will tell you, it's going to be very hard to pay those hygiene wages if you're a PPO provider. Very difficult. In fact, in many cases, Doctors, you're not even getting enough reimbursement from the PPO plan to cover the hygienist hourly rate, let alone the cost of the room, the cost of the supplies, the cost of the equipment, the cost of the admin support to put a butt in the seat. So it's harder than ever. And I'm going to say impossible, virtually impossible if you're a PPO practice because of the very low reimbursement you're getting for hygiene. Another reason to look at putting those PPO plans in the rearview mirror. But we have clients all over the country. You know, in my coaching work, we have clients all over the country that truly they meet those criteria that I defined. A third of the practice is coming from hygiene. We have 92% or above hygiene occupancy, and more than 30% or more of the adults are being treated with some mix of conservative periodontal therapy codes. And with that, they have a hygiene department that's very profitable, even with the rising wages. So yes, it can be done, but maybe not in the old way that it was done. And I'm going to suggest you're not going to get there by cramming in more patients into your hygiene schedule. Some of you might think, well, you know what? Let's see 12 patients a day instead of 8. Let's shorten the appointments and produce more. No, that's not the answer. That's not the answer. If there is a shortcut to the answer, the shortcut is not cramming in new patients, but it's getting serious about diagnosing and treating perio. Because, you know, think about what your fee is, for SRP. And I'm talking about doing this appropriately and ethically, not if you see one 4mm pocket that's stable and they get 4 quads of root plane keratosis. No, that's ridiculous. I'm talking about just getting serious about treating the actual condition in their mouth, which is they have an infection in their mouth. That's the shortcut to achieve it, not by cramming in more patients. All right, I'll get off my soapbox. But, Doctor, it hasn't changed my opinion about it. And I think when you really dive into it in detail, while it's harder today because of the wages we have to pay, it still is possible. So I hope that's encouraging to you.
Yeah, I mean, a lot of times blessings come disguised as problems, right? So I guess the problem is the high wages, but the blessing might be one more reason to slowly start dropping those PPO plans and keep all the money yourself. And then,
a lot of times we keep doing what we've been doing because it works.
Yes.
We just can't keep doing it, and it inhibits change because hey, it's not broken. Why fix it?
Right.
But I would say the system's broken if you're not getting enough reimbursement from the insurance company to pay your hygienist the hourly rate. That's
exactly.
And maybe, like you said, maybe this is an opportunity disguised as a challenge or a threat. And maybe it's an opportunity to change that. And that's the idea of changing a relationship with the PPO plans.
Thank you, Gary. Let me ask you question number 2. I have full intention of evolving to your new patient experience model, Gary. However, I feel like I need to get there over time. Where can I start?
What a great question. And again, that's part of, I think, a very practical question. You're depending on how you do your new patient now, you're probably not going to just go from the way you're doing it now to what I described in the coaching and action segment. That's too big of a leap. That's like leaping across the Grand Canyon. No, that's too much. So depending on what you're doing now, I would kind of encourage you to do a couple of things very practically to get started. I've noticed in my coaching work, when I start with a new client, one of the first things I look at is, what is your new patient experience? What is that? And I noticed that in many practices, they bring the new patient in hygiene, and then the doctor does a glorified hygiene appointment, a glorified hygiene exam as part of the new patient exam. And if that's how you're doing it, then one of the ways I would suggest you shift is that you block time in your schedule for that doctor part of the exam. In the case that I've described, where we're bringing the patient in hygiene, it's kind of a glorified hygiene exam. They treat that doctor exam just like they would a hygiene exam. Nothing goes in the schedule. It's just you fit those in between your operative appointments. I'm going to suggest putting enough time in your schedule so you can spend time with that patient to make it a better, new patient experience. The other thing I would suggest that you could also do very quickly is you could start to incorporate those 6 digital photos for patient education. Again, that comes from Dr. Frank Spear. The 6 digital photos are, photo number 1 is a close-up, natural smile, have a patient smile for you, close-up. Second is a close-up retracted view where the patient holds retractors and you see a retracted view of the smile. The third and fourth we borrowed from our friends, the orthodontists, where we take an upper occlusal view, we take a lower occlusal view using the hourglass-shaped mouth mirror. You're not taking a picture of the teeth, you're taking a picture of the flexion of the teeth in the mirror. And fifth and sixth is a right buccal corridor and a left buccal corridor. Patient holds a retractor, you take the photo pointing 45 degrees down the buccal corridor. Those are the 6 photos. So there's 2 places where you would start. And those might be a good way to kind of take baby steps towards the ideal experience. Now, the other way that a lot of dentists will bring new patients in is they bring them in through the doctor's side. And they'll do a comprehensive exam. They'll schedule an hour appointment with the doc and they'll bring it in through the doctor side. Now, I will acknowledge that in all of the major institutes, the major postgraduate institutes, the Pankey Institute, Spear Education, Coyce Center, Las Vegas Institute, all of them teach the idea of bringing the patient in through the doctor exam. And I do not disagree with that intellectually. Intellectually, I agree with that. Because now you know the condition of the mouth. Now you can schedule the appropriate hygiene appointment because now you know the condition of the mouth. However, I totally agree with it 100% intellectually. But from a practical standpoint, Niren, I'm going to put you on the hot spot here. What does virtually every new patient want for the first appointment?
Yeah, I think they want that cleaning because that's just what they think of as,
they want their teeth cleaned.
Yes.
And what you may find is that your marketing is working because you're getting the phone to ring. And then when you tell them how you handle the new patient experience, it fails because they hang up and call another office.
Absolutely.
So the idea of eventually getting to the point where you do the blended appointment that includes all, 3 comprehensive doctor exam, records, and the hygiene appointment. Now we've got a sweet spot. By the way, remember that represents 30 minutes of doctor time. It's 2 hours in the office for the patient, but it's only 30 minutes of doctor time. Work your way toward that. Anyway, there's some thoughts, and maybe you can take some baby steps toward that and keep building the momentum, kind of like the snowball rolling downhill. Keep the snowball rolling downhill and get to the point where you adopt the 7 components like we talked about.
Thank you, Gary. Let me let me ask you question number 3. This kind of leads into some of the comments you made in the last question. So the question is, what are some of the key metrics you think I need to pay attention to from a marketing perspective? I believe this listener is referring to your 5th pillar, proven marketing system.
Yeah, so I'm going to flip it and turn it to you, Niren. Name 3 or 4 KPIs, key performance indicators, that we should be measuring in our marketing to determine if it's working. It's all you.
Absolutely. The first one I'll be looking at is keywords and key phrases that are ranking on page 1 of Google. So Google has 10 results on page 1 typically. So how many keywords and key phrases are ranking on page 1? And I'll give you a benchmark. So
Niren, when you talk about results, you're talking about organic results. Can you clarify the difference? Because an easy way to get on page 1 is just throw money at Google and buy paid ads.
Exactly. You can do that. You can throw money and buy paid ads. But because the average person coming through a paid ad will only spend 15 seconds, I'm really talking about organic visitors.
And what does that
who
mean?
Are coming
for,
there
for
because you rank.
Someone that doesn't know the term organic, what does that mean?
It means, for example, Veneers Phoenix, right? That's an example of a keyword or a key phrase. So a person types that in, who shows up not as an ad, but outside of an ad in the top.
So in a simple way, organic means you haven't paid Google for that position. You've earned it based on the performance of your website. Is that a fair way to describe it? It's earned as opposed to paid.
Exactly. It's earned, and you're showing up near the top of the page without paying for an ad. And because it's earned, the word ad doesn't appear next to your listing. So that's number 1. And I'll give you some benchmarks. 95% of dental practices get no traffic from Google or very little traffic. and 5% get
Organic,
95%.
correct.
Organic traffic. 5% get 95% of the organic traffic. And if you are ranking for 100 or more keywords and phrases on page 1, you are in the top 5%. So that's the benchmark. That's what I would shoot for.
Give us a couple more KPIs.
The second one I would really focus on is number of new patient calls. So one of the things we do is we set up a call tracking number, and we can literally, to the dot, tell someone how many new patient calls are coming in through marketing. So in this case, organic marketing. And if you were to do ads, you want to know how many are coming in from, let's say, Google ads. So this way you can compare apples to apples. What's the cost of a new patient coming in through organic versus what's the cost of a new patient coming in through Google ads?
So now you can measure the performance of your of your marketing.
Yeah, my experience is organic is at least 1/5 the cost of Google ads and 1/10 the cost of social media ads. But you need to find out for yourself. So you are starting to put more money into the things that are costing you less per new patient and less money into things that are costing you more per new patient.
Give us a third KPI.
Absolutely. The last KPI I would share is the conversion rate. So this is great. Organic marketing is working for you. You are in the top 5%. You're getting all these phone calls. You're ranking for all these keywords. But how are you doing in converting that new patient call into new patient appointment? So let's say you get 100 new patient calls and you convert 50 of them into new patient appointment. Your conversion rate is 50 divided by 100, 50%. I'm going to quote you on this, Gary. You defined A as 70% conversion rate, meaning 7 out of 10.
7 or above.
7 or above. Yes. 7 or above new patient calls out of 10 are being converted into patient appointments. That's an A. So that's what you should aim for. Try to get at least 7 out of 10 new patient calls converted into new patient appointments.
Let me round that out. So if you've never tracked that, doctor, very important to track, because if marketing, if you say I need more new patients, you got to figure out what problem you're trying to solve. Is the problem you're trying to solve is you're not getting enough calls. If you're not getting enough calls, then marketing needs to be improved. But if you're getting the calls, but you're not converting it, your marketing's working. It's not a marketing problem. It's a conversion problem. So 70% or above, meaning that a potential new patient that calls 70% or more of the time, if we convert that to a new patient appointment, that's an A on the report card. 60 to 70 is a B, and you can do the B range. Closer to 70 is B plus, closer to 60 is B minus. And then 50 to 60 is a C. Closer we get to 60, it's more like C plus. Closer we get to 50, more like C minus. Anything less than 50 is failing. So find out what problem you have before you go about solving it. And the problem may be you're not getting enough calls. If that's the case, schedule a marketing strategy meeting with Equa, because they can help you get those calls. And then if the problem is you're getting the calls, but you're not you're not converting them, then I'm going to do a selfish plug here. Reach out to me and hire me as a coach, and I'll train your team members on how to answer those calls so they get 70% or above conversion rate. If you'd like to find out more about our coaching, go to thrivingdentist.com/CSM. That stands for Coaching Strategy Meeting. It'd be an hour meeting with me via Zoom. I'd learn more about your practice. We have wonderful success. One of my favorite recent examples is a client that was new to us was getting a 25% conversion rate. This is a doctor that was getting 50 calls a month. That was coming from his marketing. And he needed, in his opinion, a solo doctor practice wanted 35 new patients a month. That was his goal. And he was only getting 12. And so he said, Gary, I need more marketing. I have some budget. Do you think I should buy some Google pay-per-click ads? And I said, wait a minute. Is the problem you're not getting enough calls? Or are you getting the calls and not converting? He said, I have no idea. Anyway, we got the data for him. He was at 25%. So out of 50 calls, he's converting 12 of them. There's his 12 new patients. Well, with some training with his team, we got him to 75%. Now that means he's getting 37 new patients a month. His goal was 35. He's now getting 37. He didn't have to spend another nickel on marketing. And these were good team members. And I asked him in the beginning, how much training have you done on phone calls and converting the calls to an appointment? He said, altogether, none. So that's common. Anyway, if you want to learn more about that, go to thrivingdentist.com/CSM. I'd love to meet you, love to learn more about your practice, and we can determine if maybe it'd be a good fit to work together. Anyway, thank you, Naren, for those three metrics. Let's go to the fourth question in the Q&A segment.
Absolutely, Gary. The fourth question is, I'm early in my career and I plan to intentionally develop my clinical skills to provide more high-value services. I also genuinely enjoy many of the more advanced services. What have you found to be the best high-value services to incorporate into your practice?
This is very cool. So what I'm hearing is dentist, young in his or her career, really likes a lot of things, and where would I steer that client to add high value services, assuming that they like a lot of different things? Two jump to mind. Again, assuming you have an interest in it. Placing and restoring implants. There is very little that you can do per unit of time that's more productive than placing and restoring implants. I just made a bold statement, Naren. There's very little that a doctor can do that's more productive per unit of time than placing and restoring implants. So if that's something you're interested in, I would strongly encourage you to take a CE journey. It won't be a quick journey, but a long journey to become a master at placing and restoring implants. And then I would encourage you to stay in your lane. So place and cherry pick the cases. Don't pick any cases where there's medically compromised. Cherry pick, and then have a great relationship with a surgeon or a periodontist on those cases that you choose are not in your lane. But cherry picking the cases and really developing a full range of dental implant services would be a great addition. The other one that I'm going to say is adult orthodontics, using either aligners. I happen to really like Invisalign. I know there's others, but I like Invisalign. And maybe a bracket option like 6-month smiles or quick braces or something like that. One of the reasons I like that option is there's a massive need for it. There's a whole universe of people that have had braces as a teen or young adult, stopped wearing their retainer, their teeth start to go backwards and get crooked in spaces again, and we can help them all that with adult orthodontics. The other reason I really like it is that it's largely auxiliary driven. So yeah, you're involved in it, Doc. In the case of Invisalign, you're going to do the ClinCheck appointment. In the case of 6-month smiles, you're going to bond the brackets on. But much of the ongoing treatment through orthodontic care is done by your auxiliary team members. So both of those represent great business opportunities to profitably grow a practice. Also, those are typically things not covered by insurance. So when they're not covered by insurance and you're outside of network, you can set your own fee schedule for those. Of course, you have to be mindful of what a fair fee would be in your community, but now you're not beholden to the insurance companies for those. So those would be my two answers: placing and restoring implants and adult orthodontics. Now there's others, but that would be a good place to start if you're interested in those things. All right, as we bring it, this has been a fun episode, Naren. As we bring it in to the finish line here, I want to say thanks to you, Naren, for co-hosting this episode. Also, thanks to your team at Equa for all the amazing things you do for dental practices to help them attract quality new patients. Not only the number, but the quality of those new patients as well. Also want to thank all of our listeners. We appreciate each and every one of you at the Thriving Dentist Show. I'm going to close with 2 requests. If you feel your time is well spent listening to the Thriving Dentist Show, I'd encourage you to do 2 things. I'd ask you to do 2 things. One, go on iTunes and write a review. Let others know what you think about the podcast. That review functions for us very much like a Google review. A positive Google review works in your practice. It'll help more dentists find us. Secondly, if you like what we do, hit subscribe. That means that every Wednesday when we upload a new show, it'll be automatically uploaded to your listening device. You can do that on whatever your podcast directory is: iTunes, Google Play, Spotify, Apple Music, Amazon Music. They all have a subscribe button. It's free. And that way, every Wednesday when we upload a new episode, it'll be automatically uploaded for your listening convenience. On that note, let me genuinely thank you for the privilege of your time and tell you that we look forward to connecting with you on the next Thriving Dentist Show.